And this year's theme is Clean Hands for All, which talks about equity and achieving SDGs by leaving no one behind in hand washing, because hand washing has to do with your health, and it has to do with equity and, of course, achieving SDGs as well. To begin with, I would invite Dr. Abid Qayyum Suleri to talk about a little bit about background and how this is related with the economic issues, particularly in Pakistan, and how it can help achieve particular SDGs. Can you please join us? I also request Ms. Tanya Khan, Country Head, Water Supply and Sanitation Collaborative Council, Pakistan, to please join the podium. Mr. Thewodros, who is Chief of WASH at Unicef Pakistan, please join the podium. I now request Mr. Nadeem Ahmed, Head of Policy and Advocacy at WaterAid Pakistan, to please join us. Advisor to Prime Minister on Climate Change, Malik Amin Aslam Sahab, is in cabinet meeting right now, and as soon as he gets free from there, he will be joining us. In the start of the seminar, I mentioned that Dr. Abid would be speaking in relation with economy. So over to you, Dr. Saab.
Thank you very much, Maryam, and good afternoon, ladies and gentlemen, dear panelists, especially our guests from collaborating organizations, the three of the specialized organizations working on water and sanitation issues. It's a pleasure hosting and celebrating this day of global hand washing at SDPI. Now, the reason we thought it's important to hold this event at SDPI, not only that it is one of the Sustainable Development Goals, but also the cumulative effects of hygiene and cleanliness, especially clean water, sanitation, and washing hand. There are multiple effects, and this year's theme directly relates it with our food habits and food security. Now, of course, when we talk of food security, we are talking of people who are going bed hungry. We are talking of people who are malnourished. We are talking of people who are, for whom food is not available, and all of them, they become extremely vulnerable if they are not able to actually follow the global practices of hand washing and hygiene and sanitation. But it also turns vulnerable to those groups who are otherwise are food secure. They may not have any issue of food availability. They may not have any issue of access to food. But if they are not observing the best practices of hand washing, whatever they are eating, actually they are consuming contaminated food. And the closest analogy that I can give, having food without washing one's hands, it's just like having an excellent meal and then taking a glass of contaminated water. So, of course, having an excellent meal followed by a glass of contaminated water will not turn us into any nutrition. It would lead to food poisoning. And it's very similar phenomenon happens if we have access to food, we have food available, we can afford it, we are eating it, but if we are not paying due attention to washing our hands, we are basically contaminating our food. Now, when we say that no one is left behind, so basically what is it that we are talking about? We are talking about proactive measures and proactive policies that while most of the social protection, it is focused upon delivery of essential services, essential food items. It's focused on, for example, under ESAS program or Benazir Income Support program, some sort of grants, cash income grants. The social protection measures, they should also focus upon provision of hand washing facilities, water and sanitation. These are the two important components which should be part of our social protection programs to actually capitalize upon and to cash upon the opportunities that we are otherwise creating through our meager resources that we spend on social protection. Second, of course, if you look at the other uh, indirect benefits of hand washing, it reduces country's health budget. So either you can spend on health care system, you can spend on providing more healthcare facilities and spend more on disease cure, or you can follow some prevention practices. And one of the disease prevention practices, one of the health promoting practices is hand washing, and that's where we need to focus upon when we are talking of global hand washing day and global hand washing facility. So of course the experts sitting here, uh, Thewodros, Tanya Khan and Nadeem Ahmed, they are much more experienced than I am on this particular issue, and I'm looking forward to hear from them. And I can, if Maryam allows, I can also request our focal person on water and sanitation, Dr. Imran Khalid, to join the podium. Uh, give your input, and I'll sit there and I'll listen to all four of you. Thank you very much.
As Dr. Abid discussed, that it is directly linked to health budget, of course, of any country. We think that this simple act of hand washing in many areas of Pakistan, particularly in rural areas, it is ignored. That's why, according to one of the estimates of Unicef, around 53,000 Pakistani children under the age of 5 die annually from diarrhea because they don't either have access to clean water and soap, or otherwise they have poor sanitation services. I now request Dr. Imran Khalid, who is a research fellow at SDPI, to give some insight on this topic, please.
Thank you, Maryam. Assalamu alaikum, everyone. This is an extremely important topic. Last year, a study was out. The World Bank came up with a study where they said when water becomes a hazard. And it talked about how a significant portion of our population, especially children, are stunted. This is happening not only in the poor and the socially less well-off areas, but across Pakistan. And one of the primary reasons for that is the lack of better hygiene practices, lack of proper sanitation, lack of access to clean drinking water. And in this regard, it becomes really essential that if we are to take steps to build infrastructure that caters to our water and sanitation needs, that we also promote better hygiene. And that can only be done through awareness campaigns, that can be done through interaction with the children at the primary school level. Let's get them started, let's get them talking about the need for better hygiene at a young age, so that when they grow up, they're better prepared and they're less likely to face the numerous health problems that we see happening. So with this, I'll give it back to Maryam, and perhaps you can have somebody else contribute to the discussion as well. Thank you.
Thank you, Dr. Imran. Of course, stunting in one way is related to food, in another way it is related to waterborne diseases and water as well, and water quality, of course, as well. I would now shift this discussion to Unicef Pakistan, which is highly active in wash sector along with other organizations, of course. I would request Mr. Thewodros to shed some light that why partnership is important to address this issue, because we see that there are a lot of organizations sitting in this podium as well and in Pakistan which are working in either in collaboration or some in silos to address this issue, and how this collaboration and partnership can help achieve better goals and better impact of such campaigns. And second, that how differently UNICEF Pakistan is addressing this when it comes to marginalized communities who don't have access to sanitation and water services, and who do not have access to sanitation at all. And I would also request you to share some stories from the field if you have, like what other kind of issues, particularly women face in this area when they don't have access to this sanitation services.
Thank you, Maryam. Good afternoon, colleagues. It's a pleasure to be here and share some of our learnings and also experience from the UN perspective. Before I go into, the few questions that Miriam has raised to reflect around why partnership and how that would help us in achieving our goals, I want to share our thoughts how the Global Handwashing Day is important. Ever since it was launched back in 2008, this has been used as a way of revamping our commitment and bringing a huge social movement in terms of raising awareness around this very basic but highly efficient component of WASH that address the missing link, if you like, in helping households, mothers, children to benefit from whatever we do. Provision of water supply, for example, takes a huge investment plan around infrastructure improvement, around quality assurance, around bringing different skills and capacities, be it in the private sector or government. Whereas a key message on hygiene, for example, hand washing, just takes coining the right message, making it reach the right people with the right tone at the right places, which is more on a behavioral change. So it just takes being clear on what we want to really communicate and addressing the right targets with the right tone. And it doesn't necessarily require a huge investment. And through time, when mothers, caregivers, the less to do households or the rich, once they own and embrace this social change, it becomes like own kind of responsibility and a self-rewarding kind of activity. You don't need to have, a huge amount of money. It's just the behavioral change by itself makes people reap off the rest of, the best out of the water supply or sanitation component which the WASH package is bringing. As I move to the next question, which Miriam has posed, why then partnership is important? As I said, the challenge in countries like Pakistan, where we have a huge population, where there is a diversity in access to service, and there are also unavoidable vulnerabilities and risks, it requires everybody's effort, be it from the private sector, public ministries, the UN agencies, civil society organization, the women group, the youth group, children. Almost everyone has got a role to play. Because as I said, it's not only just putting the money and improving infrastructure. It's all about reminding mothers, reminding fathers, reminding all community members on the same message over and again. And it can be conveyed through various channels. The media has got a lot to play here. Government has a major role in terms of giving us the policy direction, ensuring the enabling environment in place. The rest of us in the development sectors are like the vehicles, if you want. There is a message agreed by all, and there are recipients on the other end of, the equation. And we are the ones who are convening this, creating that kind of enabling environment or facilitating government's kind of effort in making communities get this message, benefit from them, learn from them, guide the program, fine-tune the program, and repackage them and send it back. So this requires everybody's kind of contribution. That's why partnership becomes a critical element of the whole engagement. No one, as you all recall, one of the goal in the SDG is partnership. For us to be able to, achieve the SDG commitments, we need to work hand in hand and appreciating and recognizing everyone's kind of comparative advantage in shaping the policies, service provision, and the like. So that's where partnership becomes, the cornerstone of whatever we do. And how would that help in realizing the targets? Of course, when different stakeholders are organized and coordinated and put their kind of best skill, innovation, resource, of course, results can be achieved quite efficiently with less time and without creating duplication of effort. This would also allow to really embrace government's policy and help what is a missing link rather than duplicating what government is doing. In this regard, the Clean and Green Pakistan initiative, which is now the kind of a flagship program owned by government and launched by the Prime Minister, is offering the right kind of platform for all of us to come together, coordinate ourselves and deliver for the clearly outlined result. In this regard, I'm happy to report that hygiene, primarily hand washing, is one of the component, the 5 pillars that the Clean and Green Pakistan is trying to address. So the fact that we have come together in a strong partnership modality will make us realize what we have already outlined as a key result area under the Clean and Green Pakistan. And coming to UNICEF's specific kind of role in reaching out the most vulnerable groups and the marginalized population, as most of you may know, UNICEF has got a 5-year country program which started last year. And our program has got a sizable amount of service delivery component which target the most marginalized group in Pakistan. This is, for example, the ex-FATA, currently it's called the newly merged districts of Khyber Pakhtunkhwa province. We have got also ongoing activities in northern Sindh where the service level is below the national average. Similarly, in southern Punjab and Jang, for example, one of the most marginalized districts in Punjab, where we're trying to really help communities and the effort of government. So our program makes a deliberate effort in reaching out or covering those marginalized groups through our service delivery mechanism. The other aspect, component of our program is, of course, upstream engagement, generating evidence, piloting programs that can be scaled into covering the wider country. And in this regard, the PATS program, which has been tested, which has been used as a common approach in Pakistan, has been rolled out by governments, and UNICEF is supporting the government of Punjab, the government of KPK, or newly merged district, government of Punjab, and Sindh in rolling out and scaling up sanitation, which really helps in covering all the districts, most importantly, the most, marginalized or the disadvantaged ones. With regards to sharing, field experience, it's always rewarding to have interface with, community groups whenever we afford to be in the field. I have come across so many mothers who have become the champions of WASH. If I may share one of my experience from the recent visit to Jang. As you know, these are the communities who don't normally come, they don't really come, the female community members, they don't normally come to meet foreigners or male, visitors. But there were social organizers whom I have met and discussed. These are community members who have benefited from the program and who have been spreading the good hygiene practice message to the wider community, and who took a pride of what they have done to the program, and who have been helping the rest of mothers to own toilet, to have hand washing facilities next to those constructed toilet facilities or latrine facilities. So always it is really encouraging to see how our programs or piece of projects are transforming the left out mothers, if you like, who seem not to be aware of some of the basic message that we have been spreading for years, but benefiting from small project, small and little project here and there. So there are so many interesting experience, stories to share, but I would rather rest it here for now. Thank you.
Thank you, Mr. Thewodros, for sharing UNICEF Pakistan's experience with our four provinces and, of course, Hunza and other parts of Pakistan as well. I now request Ms. Tanya Khan, who is country head at Water Supply and Sanitation Collaborative Council, to talk about MHM program which you're looking at and what kind of challenges you're facing in particular that sector, because this is such a topic which is kind of taboo in our society, and it's really hard to even talk about it. And how we can, since we are living in digital era, so how we can use digital platforms to communicate about this such programs, and of course. How we can make this hand washing and MHM, of course, part of syllabus in at least school or college level to give awareness to the youngsters and kids at school, of course.
Thank you. Before I move on to the MHM, I would just like to highlight that I think we all are very fortunate, as Mr. Theo from UNICEF has highlighted, that the government of Pakistan has launched a Clean Green Pakistan movement. It's a flagship movement owned by the Prime Minister, so we have the political will. Because for the last 20 to 25 years, as we recall, we have been struggling to have some kind of ownership and political will of highest level on the issue of sanitation, hygiene, and safe water. And we are very fortunate that last year, I think around the same time of the year, we also celebrate 1 year anniversary of on October 12th it was launched. So 1 year has gone by, and we are very fortunate that it has provided us with a platform for engaging, collaborating, also building capacity, and as the agenda of sanitation is leave no one behind, so making sure that we reach out to the farthest of the population, as our UNICEF colleague has pointed out, in the rural areas. And we feel that we as a sector need to benefit from this opportunity. And I mean, there's been discussion on collaboration by our colleague from UNICEF. So coordination and collaboration, not only amongst our organizations, civil society organizations, but also other constituencies like the private sector, the corporate sector, the research institutions, academia, and of course hand in hand with the government. Because when we say that leave no one behind, we do not, I mean, it's impossible for the government to do it alone. And here we also look at volunteerism concept, engaging youth and notables and people from other, segment of society who can come forward and play a very critical role. A behavior change component, as we see, is relatively not that old, in Pakistan, because previously when we talked about sanitation, we would talk about hardware. So when in 2006, the first sanitation policy, when it was formulated and by the Ministry of Environment at that time, which is now the Ministry of Climate Change, the soft program, the behavior change component, was the big paradigm shift, So it focused on that if you need to address the issue of sanitation and hygiene and reduce diarrhea, you need to focus primarily on changing the behavior of the people, especially the people in the far-flung rural areas, people with disabilities, people in conflict and emergency situations, people with old age, and people with different other, when they're excluded. So when we talk about MHM also, we look at it from the concept of inclusion. So equity and non-discrimination, which is now the global slogan, they call it EQND, making sure that the government policies and also the policymakers in the external support agencies and the private sector and others focus on how to reach out to the marginalized people. So we look at how we can make sure that through our policies and through our programming, we address the issue of non-discrimination and inequality that we have in our society. And under that ambit, we look at some of the issues which are hushed issues, which are not talked about issues. So there, when we talk about hygiene, the hygiene of women and girls, especially in their days of menstruation, is very critical. Initially, when this concept was discussed at the policy level, there was a lot of reluctance, of course, But then, of course, with a lot of like investment and discussions in the sector and some of the government officials coming forward as champions at the federal and provincial level, the issue of menstrual hygiene management is now a critical component of hygiene within the Clean Green Pakistan movement, which means that educating the girls in schools as well as women and girls in the communities, because we must not forget that a large proportion of girls do not go to school in a country like Pakistan, especially in our rural areas and slums. So policies have been included at different levels. So it's an intersectoral approach. When we talk about behavior change and hygiene and women and girls' health, we talk about intersectoral approach because it's not the mandate of one particular ministry or department. It's an intersectoral, so the Ministry of Health, the Department of Health in the provinces, the Department of Education in the provinces, the federal level also, the ministry that is here, the Environment Department, Public Health Department, also Social Welfare, Women Development Department. So all the relevant departments at the provincial level have a very critical role to play. And of course, the policy directives and guidelines from the federal level from the concerned ministries is very critical, and that's a role that the Ministry of Climate Change is playing in this Clean Green Pakistan movement. And one thing that I would just like to also highlight is that when we talk about integrated approach, we cannot see hygiene or, for that matter, menstrual hygiene management in isolation. We have to club it with, as our colleague already mentioned, that we have to club it with safe water, because if there's first of all water for sanitation and hand washing and hygiene, so if there's no water available, you cannot practice, So, and also when we talk about having sanitation facilities at homes, in institutions, in educational facilities, that's very critical. And then most importantly, the behavior. If you're not washing hands, as we today commemorate this day, if you're not washing hands and if you have proper safe sanitation facility in your house or in your school, and if you have safe water to drink, but if you're not washing hands, then the purpose of all those other, services and facilities, do not play any effective role. So our integrated approach is very critical. And how we are reaching out is that we are very fortunate that we have at the national level a menstrual hygiene management working group. And then we have at the provincial level, the provincial MHM working groups, which are headed by either the local government in Khyber Pakhtunkhwa, Sindh department, there's education department, which is heading, the local government department in Balochistan is heading the one in Balochistan, and in Sindh and in Punjab, we have the health department, which is heading. So through the working groups, which has membership from the related government departments, civil society organization, external support agencies. We are working on capacity building and institutionalizing and making sure that MHM is reached out to the grassroots and to the most far-flung area, addressing to our jargon of leave no one behind, LNOB. Thank you.
Thank you, Ms. Tanya, for discussing, of course, this cross-sectoral and integrated approaches are very important to discuss about. But with your discussion, I also want to ask one more question and would like you to shed some light on that in different provinces, what is your experience with community leaders or a champion of change on MHM? How they are responding to that? And you discussed about behavioral change. So in what province, if you could talk about that, which province was welcoming such initiative at community level and which provinces were reluctant, and what were those reasons?
Well, if you need to make a dent in the policy, first of all, you have to look at champions within the government. So we have some very able government officials in, I wouldn't say just one province, I would say in all 4 provinces, who have taken the torch and are leading, and they've also influenced their departments. So they are actually also the chair of those working groups as well. The idea for first sensitizing the key government official is because then, for example, if it's education department, then it puts in a directives that all schools should have MHM facilities and should sensitize the girls on the importance and behaviors of clean, hygiene. And then, of course, all the other uh, external support agencies and development partners, like we have Unicef here, we have GIZ, we have WaterAid, and we have Hands, and many others who are sitting in here. So they all then align themselves to help them build their capacities. So the idea is to reach out to the maximum, the masses, not just communities and pockets. So if you influence policy and then they're programming, then you're talking about scaling up, And within scaling up, then of course we have health department, the role of lady health workers in reaching out to the communities and mothers in far-flung rural areas is very critical. And I would say that government of Punjab has already included the messages of MHM in their lady health worker training manual. Similarly, government of Sindh is working on curriculum, including MHM in curriculum, and UNICEF and WaterAid is helping them along with Hands in the government of Sindh. In government of Khyber Pakhtunkhwa, through their WASH cell, they are doing a lot of capacity building initiatives in there and reaching out to the districts. And I would also say that the local government also plays a very critical role. And especially now we are all looking forward to the new local government reforms, because that would help us systematically take things down to the grassroots level. So in education, in health, and then of course we have religious leaders. We must not undermine their role. In fact, I would highlight that UNICEF last year engaged the Islamic Council of Ideology, and they came up with, all these messages, and there were certain seminars which religious leaders also highlighted. So the whole idea is that along with hygiene, women's health, as well as hand washing and all, religious leaders should play a very important role. The OCAF department is already involved in all 4 provinces, is working on it. And we are hoping that even the message of global hand washing, hygiene, sanitation, safe water, the religious leaders play a very important role, especially in their sermons that they do in the mosque, and also, of course, in their daily engagement with the community. Thank you.
Thank you, Ms. Tanya, for highlighting the role of course, religious leaders. And if there is a political will on any issue, then implementation of any important programs or issue becomes very important. Now I would move towards Mr. Nadeem Ahmed, who heads policy and advocacy at WaterAid Pakistan. Mr. Nadeem, I would request you to please highlight advocacy component, since you head this department. And one of the important component of this Global Hand Washing Day is, of course, advocacy. How differently WaterAid is communicating on this issue, and which districts of Pakistan your organization is really covering, and where do you see the problem? Because 2 of our panelists mentioned about cross-sectoral and integrated approaches. And 2, of course, our panelists told that this has to do a lot with behavior change. But do you think that does it has to do with policy change? Does our policies address this, or do we need change in that? And where exactly change is required?
Thank you, Maryam. In terms of your first question, what WaterAid is doing, we usually collaborate with our sector partners and the government for joint action. So during the last government, we all were working on Saaf Sehatmand Pakistan. That was a campaign that primarily were working on behavior change and as well as some advocacy component. When Prime Minister in the first cabinet meeting of this government decided to have a cleanest campaign, one of the advocacy that we quickly took, that to have these water sanitation hygiene components added to Clean Green Pakistan, because at the cabinet minutes you see it was about mostly waste management and plantation. So one of the advocacy that we were put forward to the Prime Minister, that hygiene behavior change, water sanitation is a key component, and it is now part of the Clean Green campaign. I think there are two problems in this country promoting hand washing behavior. Uh, one of the challenges that simply awareness cannot change people's behavior. If people are sitting in this room, they all know it's important to wash our hands, but many of urban areas it's not habit. So one of the challenge in terms of the people who are working water sanitation to make its habit. In urban areas, people are mostly less exposed to fecal contamination, and it's a mostly clean environment. So many of us even don't wash hand. We can live without, because the lack of contamination around. But in rural areas, the setting is different. They don't have mostly a fixed station to wash hand and availability of source. I can tell you a very interesting fact why this issue of priority and making it habit. We analyzed Punjab Mix. Mix is a survey where we find availability, water sanitation, and also hygiene practices. So there was 16% people in Punjab. They had mobile phone, the digital mobile phone, but they did not have soap in their houses to wash hand, which clearly indicate the priority of the people, that what they actually think is a social status. And that's where we people who are working in development sector need to focus on changing the social norms. And it's not just water sanitation sector. Every development initiative need to work on behavior change, because of the services cannot sustain. Um, we heard earlier the example of drinking contaminated water with the perfect meal. Imagine if government of Punjab or Islamabad government makes a 1 billion rupees with water filtration plant, and somebody from G6 goes to get the water, and the container is a chemical wala neela. The whole purpose of government investment is losing because of the behavior change. So that's why the behavioral aspect or hygiene behavior is the first or core behavior that we think can bring the change, because hand washing behaviors are connected to 44% of diarrheal diseases and 23% of the respiratory disease. So if just hand washing with soap at critical times, that we say in our term, can reduce hospital occupancy of many patients. Put 44 and 23%, many of these patients won't come to hospital, and the government won't have to spend too much money on health expenditure. And the people, poor people, don't have to spend most of their money on out of pocket expenditure on health. I remember a lady in Muzaffargarh said that, in Urdu, I can translate it later, कि 20 रुपए का साबुन मेरे 2000 रुपए बचा देगा. My 20 rupees soap can save me 2000 at the health expenditure. So this is the one behavioral social norm we need to work on. The other challenge from advocacy side is doing behavior change at scale. The government official, the planners, Ministry of Finance, Ministry of Planning, they don't really think, oh, hand washing with soap has to do with anything development. No. What is this? It's a simple thing. And as I mentioned, how it can change the government expenditure and government footprint, the public exchequer. But we need to, if one district, for example, in one part of the country, people are behaving as per, hygienic requirement, but the other part of the country, they are not, and the social norm is not created in the country. So we need to work behavior change at a scale. And there are already, in my opinion, 500 to 600 billion rupees projects going in this country, which can adopt behavior hand washing messages without any additional expenditure. I can tell you in Sindh, it's a Saaf Sutro Sindh program, it's accelerated action program on nutrition. In Punjab, is Chief Minister accelerated program on nutrition, Clean Green Pakistan initiative. We also have Ehsaas program. It has lady health worker program, polio campaign, TB campaign. There's so many other programs where the government just have to do nothing, just these messages and then a little bit intervention to it. So there's already program going on. We just need to synchronize. I think one opportunity is this country's a clean green campaign or the movement. So the Prime Minister Clean Green movement, Prime Minister himself said it's about changing mindset. So that program should take lead in the coordinating all these large scale government intervention to, without a substantial investment, change the behavior. And that's the, I think, advocacy agenda for all of us in this room.
We also see that in Pakistan there are a lot of issues, particularly if we talk about schools. Dr. Imran, Khalid, there are a lot of schools which only have one washroom and which don't have soap or any such thing to wash hand, not even, I think, simple tab. So do you think that in that sector there's this policy gap or this research gap or governance, or there is some problem with educational policies or less priority of the government? Where do you see the problem?
Thank you, Maryam. I think it's just that we haven't perceived the wash sector in the way that we should have. For example, our focus on physical infrastructure, when we talk about school, it's always, building such and such number of schools, such and such number of classrooms, but it's never about, if I can go beyond that, to say who the students will be, who will be teaching them, what the qualifications are, and then what will they do during their breaks? Will they have enough room to play? What kind of equipment will they have? And if they need to go to the bathroom, what kind of facilities will they have? Will they even have water? So I'll give you my experience. When I used to go, when I was about 10 or 12 years old, I used to be in a government school, and sometimes there was water and sometimes there was not. There was never any soap, by the way. There was no soap. So that's the thing. And it's just a classroom will have a chalk, it will have a duster, it will have chairs, but never any soap. So what and it's not that complicated. There can be things done whereby you can have a constant supply of soap in the bathroom. You can have constant supply of water for that particular purpose. It's not going to cost us a lot of money either, because it's not. We don't need a lot of investment in that. It's just needs to be a political will, and as my colleagues have just mentioned, this government is showing political will, and we hope that they can take it forward. We did a research study that Maryam was also part of in Dera Ghazi Khan and Jhang, where we looked at communities affected by floods and disasters, natural disasters. And one of the reasons that was cited in terms of not moving from their homes in the situation of crises was that, well, if we move to a certain camp, or if we move to a railway line, which is usually higher than the ground, and that's where people set up camps when there were floods, they didn't do it because they said, we've got daughters and there will be no facilities for them, sanitation facilities for them. So it's something that we really need to inculcate, especially in times of climate change, in times of other health crises that we have. So the integrated approach that everyone's been talking about will be necessary. And once we start to do that, and we realize the importance of water, sanitation, and hygiene for our collective well-being, then perhaps we'll come to a point where your question will always result in the answer being that we've always had, perhaps in 10 or 15 years, that yes, we always have soap in our bathrooms and we have enough water to meet our needs.
So, Dr. Imran, you were talking about schools. I can quote example from university. Even university don't have that facility, and they only have this facility for faculty members, which are usually locked, and they have keys to use that. Unfortunately, in Pakistan, this brings me to again move to Mr. Nadeem about talking about advocacy. Advocacy, of course, have this component of media, which is a very important tool for any campaign. How do you see media in these campaigns, particularly if we talk about hand washing or sanitation or water availability, because these all things are interrelated. So do they really cover those things, or how you sensitize them? Do you conduct trainings with them as well, or does your advocacy campaigns has to do with communities only and policymakers?
In terms of WaterAid, we have is media fellowship program. We used to call it young media fellowship program, but those fellows are not seasoned journalists, and they say, don't say us young. We are now senior journalists from all the media outlets, and they understand the problem. And whenever these kind of policy issues are raised, they do the research-based stories on behavioral side of the intervention. Media can, I think the media is the most influential component of this any campaign. For instance, I can quote an example, and some of my colleagues from media can relate to that. In 80s, Coca-Cola placed in every drama whenever somebody, oh, of course, the amount then dramas they can or movies they can manipulate. Whenever there's a script, somebody is coming at home or trying to drink something, there's always a Coca-Cola, drink. It's not part of the advertisement, it's part of the movie. So hand washing at a critical time can be made part of the scripts. All these writers or these drama people, because many of our audience now, they prefer drama and entertainment rather than the news one. So that's a one component where we can have media becoming part of the campaign. The behaviors that we try to promote, they can make part of their scripts and screenplays. Also, the media, they have a portion for community awareness messaging that they can lend to these national campaigns where we are trying to promote these positive behavior. But the fundamental problem is that the nature of messaging should be very universal and systematic, and that can come from a national strategy. In terms of policy, we don't need any policy on hand washing, in my opinion. We only need to have a good strategy, good messages, good communication products that we can give it to media based on the research, and we can place some nudging into that communication. So I think they can play a very key role in terms of supporting the national ambition to change behaviors. Not just hand washing with soap is the most easiest and the most effective in terms of relative behaviors, and that's why we focus on this behavior most. But from these behavioral messaging that we deliver, and all other sector can benefit. Our these energy companies that they always been saying people that bajli bachaiye apne liye kaum ke liye isn't working, which means we need to have a behavioral intervention. We're saying hand washing with soap will, if you don't wash your hand, germs will contaminate your hand and you will get disease, and doesn't make any substantial change. So that's where media can be useful to give right messages, and it has to be because the behavioral change is associated with the habit change, and that will take time. So that's where I think media can support a long-term intervention like behavior change or hand washing with soap.
Thank you, Mr. Nadeem, for telling about national strategy. Of course, I think we see this as a very simple act, but it has to do with a lot of SDGs somehow, and of course our budgeting as well. So I would request Dr. Imran Khalid to please conclude this session.
So I think we've had a wonderful discussion today, bringing in different perspectives from the international point of view, through UNICEF, from organizations that are working in Pakistan, across the provinces. And if I can say that the glass is definitely half full, I don't think I'll be wrong, because of the initiatives that have been taken. The Sustainable Development Goals, we've got about 10 years to go before we come to 2030, when they're due to be completed, and water is an integral part of those. And I think having Clean and Green Pakistan talk about WASH and take that up will go a long way in contributing towards that. And then obviously behavior change, as we've been talking about, is definitely an essential part of highlighting and taking forward the need to meet the equity gap that we see in terms of WASH. So I think it's definitely a positive thing that we're working on, and we'll continue to do that with SDPI will continue to do that with partnerships with the government agencies, with international donors, with the media, of course.
I think the panelists rightly mentioned about this behavioral change, which starts from home and then followed by schools, and of course then it comes to political will to address communities and children who are out of school, of course, and where UNICEF is also reaching those communities which are more vulnerable and who do not have access to sanitation and clean water services. I think we all need to play our role in individual capacities as well as in institutional capacities to address such issues, which seems very I should say very light and non-issue, but it is very much issue when we linked it to other sectors like health budgets, our education, our values, norms, and if we talk about our religious practices, it's not only Islam but other religions as well. Everyone talks about, every religion talks about this clean and a clean thing and clean environment and keeping ourselves clean. And for that, clean hands are very important. With this note, thank you very much to our panelists and to the audience and media for participating in this seminar. Tea is served outside. Thank you.